presented by Kelly Batista, Director of the Cancer Institute, Peter Taylor, our Vice President of Strategy and Marketing, and Dr. Jim Fiorica, Chief Medical Officer. They outlined the rising number of newly diagnosed cancer patients, the complexity of cancer care, and the advancements in treatments as aspects for the need to develop comprehensive cancer care services in Sarasota. Lori Lang, our Chief Operating Officer, reviewed the vision for Sarasota Memorial Cancer Care. The vision to provide true cancer care beyond treatment alone is built upon key guiding principles, such as providing access to a full continuum of services, using a team approach and evidence-based guidelines, and promoting a positive patient and family experience. She was joined by Dr. Richard Brown, Medical Director of the Cancer Institute, who presented the programmatic priorities and accomplishments to date. She then detailed the Cancer Center project milestones, including a review of the previously presented dates from the December 2017 Mission and Planning Committee meeting. Addressing both the system growth as well as cancer care service needs, the Cancer Center will initially include 3 facilities as part of a comprehensive design for cancer care. She reviewed each of the 3 facilities, including a freestanding radiation oncology center, a cancer care inpatient and surgical tower, and an outpatient cancer care pavilion to be built in phases. The first 2 phases, the radiation oncology center and the inpatient tower, were discussed in greater detail, including schematic design, service planning, and program pro formas for each facility. The facilities would begin design concurrently with the projected opening of the Radiation Oncology Center slated for early 2020 and the tower scheduled to open in the fall of 2021. Bill Wojden, the Chief Financial Officer, then presented the anticipated project costs for the first 2 phases and financing solutions as part of a system-wide financial analysis. Lastly, Mr. Verinder closed the presentation with a request for feedback. The Mission and Planning Committee made the motion and passed the recommendations to the Board of Directors to establish Phase 1 and Phase 2 of the Sarasota Memorial Comprehensive Cancer Center. This project amount is in addition to the previously approved $4 million for the schematic designs of the center. And at this time, I move approval of the expenditure of $220 million to establish Phase 1 and Phase 2 of the Sarasota Memorial Comprehensive Cancer Center as recommended by the Mission and Planning Committee. Do
we have a second? Second. We have a motion and a second. Any discussion? All those in favor of the motion on the floor, please signify by saying yes.
Yes.
Yes. Anybody opposed? Motion carries. Great. Congratulations.
Thank you, Mr. Chairman.
Effort. That's a tremendous effort, and I think really the next phase of the evolution of this health system.
Absolutely.
Thank you.
And that concludes my report.
Thank you very much. Finance Committee, Jim Meister.
Thank you, Mr. Chairman. This morning, we met in joint session of Finance and Audit Committee, and at the request of the board chair, I chaired the joint session. The minutes of the November 20th, 2017 Finance Committee were approved. The minutes of the October 16th, 2017 Audit Committee were approved. Lori Neeson and Julia Safina of KPMG presented the draft results of the audit of the year 2017 financial statements of the district. They reported that the audit went well, and they summarized the numbers at September 30th, 2017. They also reported on significant audit areas and management judgments and estimates used in preparation of the financial statements, and I move acceptance of the audit of the year 2017 financial statements of the district as recommended by the Finance and Audit Committees.
Second that motion.
We have a motion and a second. Any discussion? All those in favor of the motion, please signify by saying yes.
Yes.
Yes. Opposed? Motion carries.
The accounting firm of Bobbitt Pittenger presented the draft results of the audit for 2017 financial statements of SMH Healthcare Retirement Plan. They reported that the audit went well, and they summarized the numbers as of September 30th, 2017. They also reported on significant audit areas and management judgments and estimates used in preparation of the financial statements. The plan's net pension liability decreased by $16.7 million from September 30th, 2016 to September 30th, 2017. I move acceptance of the audit for the year 2017 financial statements of the SMH Healthcare Retirement Plans as recommended by the Finance and Audit Committees.
We have a motion and a second. Any discussion? All those in favor of the motion on the floor, please signify by saying yes. Yes.
Yes.
Anybody opposed? Motion carries.
Nelson Lane, our comptroller, presented the district's credit profile as of September 30th, 2017, and graphs showing the historical trends of our financial ratios. Our financial position is very, very strong. For many ratio metrics, the district is performing better than the median metric of similar rated healthcare systems. That's for information only, no motion necessary, Mr. Chairman. Lastly, Mark Thornton, our Director of Audit Services, gave an update of internal audit projects for the first quarter. He spoke about Visitor and ID Badge Committee, simpler contract accounts payable review, safe practices and drug diversion prevention program, wire transfer controls, Smart Plan 2016-2017, laptop computers, asset inventory, encryption and CompuTrace status, and lastly, FEMA public assistance application. There's no motion required, Mr. Chairman. That concludes my report.
Thank you, Jim. All right, next up is our President's Report. David?
Thank you, Mr. Chairman. So before I start in on my normal presentation, I do want to just take a moment and thank the board for approval of the Cancer Center on behalf of the hospital administration, our physicians, and our community. I think it's really is something that's monumental and shouldn't go unnoticed, and I appreciate the trust you've put into our administration to pull this off. So.
We really want to recognize you and your staff. They put a tremendous amount of work on this and presented a proposal that was thorough, well vetted, and acceptable to the board.
Thanks, and I mean, I really can't stand here and say thank you for that without recognizing Lori Lang, our Chief Operating Officer, for her leadership on it, and Kelly Batista, who I think is in the back. She is. For hers, because they put their heart and souls into that. So.
Well, we got the strategy out of the way. Now the tactical falls.
Now the easy part, right? Yeah.
I'm not sure about that.
I'm not either.
On plan and on budget.
Yes, sir. That's our goal.
There you go.
So, okay. I'm going to start today, as I always do, with our organizational report card for the year-to-date through December of 2018. Actually, I think it would be fiscal year-to-date 2017 December, right? Is that right, Bill? Okay. All right. You get what I'm doing. So I'm going to look at a service pillar. Start with our HCAHPS inpatient number of domains. We have a goal of being 8 out of 11. The number of domains being at or greater than the 50th percentile. Happy to report we are hitting 8 out of 11 as of this past month. On the outpatient, we have a goal of hitting 55 out of 58 of the domains at 50 percentile or greater. Happy to report we're at 56 out of 58 on that right now. In the people pillar, we have a goal of having turnover of our part-time and full-time staff that have been hired within the past 12 months at being at less than 25%. We are a little bit over that at 26.28%. Lots of action plans going on with that, continue with our staff. In the quality pillar, we have a goal of having our infection prevention, which is our combined overall standardized infection rate, below 0.95. Happy to report we're well below that at 0.887. And if you just put in that perspective, the predicted number from the government and the national average would be 1.0, so quite a bit under that. Finance pillar, you heard about our finances earlier from Bill, our Chief Financial Officer, but we have a goal of having our operating margin at 5.1%. We're currently projecting the year to hit 6.1%. And in a growth pillar, we have a strategic growth organizational goals on the inpatient side of being inpatient admits plus outpatient observations. We have a goal being 38,899. We are exceeding that goal, or projecting to exceed that goal at 45,806. And outpatient registrations at 799,000 is the goal. We're projecting to exceed that at 818,000. So looking in a little deeper into our HCAHPS scores, you can see on the left-hand side the 11 indicators that we track, and the government tracks. You can see what the national average is in the middle, and you can see finally on the right-hand side where we are. The green being items that we exceeded the national average, or 50th percentile. The red being ones that we're a little bit short on. Those being responsiveness of staff, cleanliness at a hospital, and quietness at a hospital environment. I did want to show this time a comparison of where we are with other hospitals in the area. This is off the Medicare.gov hospital compare website. And so the timing's a little bit different than what I had just shown you, but you can see at this point in time, we were 7 out of an 11 at 50th percentile or greater, and you can see where the other hospitals in our region compare. So not that we were satisfied with 7 out of 11, but it's certainly it's a challenging number to get to, and one that we're always trying to improve on. Moving into service, Sarasota Memorial and Sigma Theta Tau International Honor Sorority of Nursing recently partnered with Friendship Centers to provide wish list items for local seniors in need. SMH's Karen Reynolds coordinated efforts with the Nursing Honor Society and several hospital departments. So we appreciate Karen's work on this, as well as our other volunteers. Staying in service, SMH hosts our Parkinson's Symposium. Anyone who has experienced a family member or loved one having this terrible disease understands the need for support and for resources. We've partnered with NeuroChallenge for years to be able to provide this annual education and symposium. If you have an interest in that area, I would highly recommend that you go out to it on Saturday, January 20th, and see what it's about. It's really an amazing event that we do every year, and I just welcome the community. In quality, the report cards are out for the nation's hospitals, and Sarasota Memorial received highest 5-star rating for the 4th consecutive time, retaining its title as the only hospital in Florida to consistently earn 5 stars in all rating periods since the program's inception in 2016. Additionally, SMH is one of only 58 hospitals nationally to earn this highest award 4 times. Staying in quality, Sarasota Memorial recently earned recognition as baby-friendly designated hospital, one of 477 facilities in the U.S. to be honored for demonstrating excellence in maternity care and infant nutrition. The designation is a culmination of several years' hard work and dedication by the Women's and Children's Division, pediatrics, obstetrics, first physicians, OB staff and providers, supply chain, LESAR, and every hospital area that cares for childbearing women. So congratulations to our staff there. Sarasota Memorial orthopedic specialist Dr. Ed Stolarski was among the top 5 highest volume U.S. physicians for hip and knee replacement for Medicare enrollees from October 2015 to September 2016, according to Dexter, an analyst. Dr. Stolarski's 575 total discharge for Florida Medicare enrollees led the state. So we'd just like to congratulate Dr. Stolarski and thank him for choosing to practice at Sarasota Memorial. Moving into people, we had our SMH diabetes educator, Lynn Gordon, who's an RN, recently appeared on the Suncoast View to offer healthy living tips and demonstrate what goes into our favorite foods. Diabetes Treatment Services will offer information sessions about the Prevent T2 program on January 29th from 12 to 1 and January 31st from 5:30 to 6:30. The Prevent T2 lifestyle change program can help cut the risk of type 2 diabetes by more than half. Please call the number listed below for more information. Sarasota Memorial welcomed New Year's baby Colton Campbell Arbuckle into the world at 5:31 a.m. on January 1st. The first SMH-born baby of 2018, Colton weighed 5 pounds, 7 ounces, and was 19.25 inches long. The last SMH baby born in 2017 arrived at 6:43 p.m. December 31st, bringing the New Year's total baby delivers at the hospital to 3,627. So welcome to all of our new children. So every year we find that on Christmas morning, Mr. Claus and his band of elves makes a special stop at Sarasota Memorial's Pediatric and Mother Baby Unit, donating toys to the young. Santa and his elves include Greg Kalish, the Sarasota Memorial Chief Legal Officer Carol Ann Kalish, and their young elf Ben Kalish.
Our now 21-year-old elf.
Yeah. This is the 35th consecutive year that Sarasota Memorial attorneys have arranged Santa's visit and donated toys. So, Carol Ann, thank you for you and your family doing that every year.
It's our favorite thing.
Patients and staff and visitors recently enjoyed a holiday concert at the hospital with musicians from Upward Notes. I don't know if anyone had the opportunity to be here in the courtyard to hear that. In and around the hospital, but they're amazing, and we very much appreciate their time and effort to come up here and entertain our guest. In the growth section, I would like to welcome a new physician to staff, veteran GYN oncologist Richard Boothby, recently joined First Physicians Group. He's board certified obstetrics in gynecology and oncologic oncology. Dr. Boothby has more than 30 years experience managing care of women with gynecologic cancers. Dr. Boothby takes over the practice of GYN oncologist Dr. Jim Fiorica, who transitioned to full-time leadership role at Sarasota Memorial as the Chief Medical Officer. Dr. Fiorica will continue to lead the Sarasota Memorial's Cancer Research Program. Thank you, Jim. Appreciate that. And finally, Health Connections offers free wellness classes to help people get the start to the good years. There's several listed here. We welcome you to go to our website and participate in these, and I would encourage the community to take advantage of things that are courses like this that we have offered here. And just thank you and Happy New Year.
Thank you, David. Same to you. Same to you. Thank you. Any questions for David? All right. Last couple items, because we have nothing on the consent agenda. Any public comments? All righty. Legal matters?
Nothing to report.
Righty. Well, with that, I will, we have no other business, so I will adjourn the meeting. Thank you very much, everyone. Happy New Year.